I'd like to share what I've learned about becoming a child life specialist. These individuals work in a hospital setting to help patients who are children understand their diagnosis and help them to cope with their treatment, and they do this through explaining medical procedures and through trying to make it as normal experience as possible through therapeutic play. They help the patient as well as the parents and siblings of the patient. And from what I understand, this is mostly a hospital environment. There was a child life specialist who I read about who was able to travel to the schools and educate the classmates of an individual receiving medical treatment, and she explained to the classmates what they could expect upon the child's return to school. So that was interesting. On a discussion board I found, there was a child life specialist answering questions about her career, and she mentioned some of the difficult things she encounters are when children don't want her help. They refuse it. Also, there are serious circumstances to deal with, and not every child gets better. So emotionally, that was very draining on her. She noted that there was a high burnout rate among her coworkers. Another difficulty to consider is that it's a hard job, and the highest range I found for the salary was $65,000 a year, and that was less than 10% make that much. The median, the average salary was $48,000 a year for a child life specialist. The low range was $42,000 a year. So that range is what you can anticipate. Right now, a bachelor's degree is all that is required. A bachelor's degree in human development, child development, and even recreational therapy or something like those in that field. Right now, a master's degree is not required, but you can anticipate needing one in a few years to get this kind of a job. There is a professional certificate available for a child life specialist. Not all employers require one upon hire, but do want you to have that within 6 months of getting the job. I also found out that it is pretty competitive to find a position, an opening. There are a lot of volunteers that also participate in this program, and so jobs are, from what I understand, few and far between, and being willing to move to a location where there's an opening is an added plus if you're planning on picking this career. Overall, I think my thoughts on this job is that if you enjoy children and if you like helping people cope with difficult situations and don't mind the pay or dealing with sometimes the serious environment that this job requires, that it would be something you might want to look into. Thank you.